Hello everyone, and welcome to our presentation. Our group consists of Shirasi, Jackie, and Katie. As indicated in the second slide, we are proud to introduce to you CJK Laboratory. A tidbit about our lab: we are a rural laboratory located at 6158 Advanced Laboratory Boulevard in George Washington County in the District of Columbia. Since we are a small rural laboratory, our hours of operation are Monday through Friday from 8 a.m. to 5 p.m. We are closed on the weekends and during most major holidays. To the right, you will see an image of our laboratory's logo, creatively designed by our very own team member, Katie. CJK Laboratory operates within the accreditation standards of the following entities: the Clinical Laboratory Improvement Act, also known as CLIA, the Food and Drug Administration, also known as the FDA, the Joint Commission, known as TJC, the Commission on Office Laboratory Accreditation, known as COLA, and the College of American Pathologists, known as CAP. In 1988, Congress passed the Clinical Laboratory Improvement Amendments, known as CLIA, which established standards for all laboratory testing. CLIA 88 ensured that the results of laboratory testing are accurate, reliable, and that punctuality of patient results are met irrespective of where the tests were performed. Proficiency testing, known as PT, is required of laboratories that hold certificates of compliance or certificates of accreditation, meaning those laboratories that conduct tests found in Subpart 1 proficiency testing programs for non-wave testing. The PT agency that our lab utilizes is CAP. We chose CAP because they are a professional association of pathologists, known for providing laboratory proficiency testing and accreditation services approved by the Centers for Medicare and Medicaid Services, which is the entity that published the final CLIA Quality Systems Laboratory Regulations in 2003. Our scope of service consists of 5 points. The first is to provide excellent service in laboratory testing by providing quality results that are accurate and in compliance with all regulations. The second is to focus on removing errors in our total testing process during the pre-analytical, analytical, and post-analytical phases through continuous staff training and education. The third is to reduce variability through standardized testing procedures, monitoring performance via a quality control system. The fourth is to ensure quick testing turnover time without compromising quality of care by means of organized staff management. And finally, the fifth is to maintain our CLIA accreditation and to continuously carry out a quality management system of the laboratory. CJK Laboratory serves patients of all ages who visit our clinic. As indicated here, these populations include neonatal and infants, children and adolescents, adults, and the elderly.
In creating our vision statement, we attempted to encapsulate aspects of a lab that we felt as though are important. What we were able to derive was that qualified individuals, efficient technology, and ultimately unmatched services were aspects that we felt needed to be exemplified. Therefore, our vision is to become a distinguished laboratory in the District of Columbia, Washington, renowned for the training of quality and superb medical laboratory technologists, and for the exemplary services provided through the use of novel cutting-edge technology. Transitioning from our vision statement to this mission statement, we use the same overarching ideas and define them to what we believe that signifies. We strive to excel in delivering efficient, expedient, and high-quality services in patient care, to improve diagnostics through innovative technology and standardization, to establish a standard of care and quality assurance through employment of a range of staff and encouragement of continuing education. Our lab contains both waved testing and non-waved testing. and non-waved testing can be broken down into both moderate and high complexity testing. Waved tests are considered tests that are simple enough to be carried out at a low risk for an incorrect result, deemed appropriate under CLIA, CAP, FDA, and our other accrediting agencies. We have achieved our certificate by enrollment in the CLIA program, payment of fees, and follow manufacturing test instructions. Our decision to incorporate this further supports both our vision and mission statement to provide rapidly available results for physicians and their patients. In addition, as a result of our ability to run more complex tests in order to remain credible, we are CMS approved via their proficiency testing program, as previously mentioned by Jacqueline, and must participate in biannual inspections as well as follow all criteria previously mentioned regarding waived testing. Choosing to carry out more complex testing is important in a rural setting where there is no luxury of choice in terms of laboratories. We demonstrate flexibility in services we provide for those who choose us as it pertains to our test menu, which will be explained briefly and shortly. Our lab contains 4 departments: chemistry, hematology, immunology and serology, and lastly microbiology. And we carry out particular tests within each of those subjects, which will be further explained. The chemistry department runs both potassium and calcium testing, which are critical for diagnoses of major health conditions where known levels are essential for physicians. The hematology department conducts CBCs as well as the additional platelet count, which can serve as a baseline and monitoring test for a facet of needs for physicians. The immunology and serology department runs both RPR and HIV testing submitted by physicians for the presence of possible infections. Lastly, the microbiology department conducts testing to determine the presence of microorganisms through the use of wet prep/mounts, ova, and parasite screening, as well as aerobic cultures. This SOP for chemistry pertains to the potassium test. This was created based on the Beckman Unicell model. However, as a group, we chose the Vista Chemistry Analyzer for our lab. The procedure manual varies for the 2 instruments, but the idea is still rather the same. The purpose of this instrument as it pertains to potassium is in order to diagnose and treat conditions such as renal failure, hyperkalemia, hypokalemia, and other diseases that result from an electrolyte imbalance. This slide particularly highlights the materials, reagents, quality control, and test procedures associated with this test. This slide covers how calculations and interpretations are derived based on this particular system. For the most part, the system is able to calculate most of the information within itself and is able to generate values that pertain to either normal ranges or critical values that are then notified to the individual who is running the test. Ultimately, a supervisor is going to be required to overlook all of the results prior to the release of the information to the patient or physician. This slide takes a look at any corrective measures that may occur and a procedure that is implemented to do something about it. It overlooks the limitations of the procedure overall. There is a table demonstrating the normal values that pertain to the potassium serum that we receive, what critical values are considered, and lastly, how reporting occurs. The link at the bottom right corner is the SCS for this procedure or laboratory procedure in general.
One of the tests we're going to run in the lab is a standard wet prep. It is to help in the diagnosis of trichomonas infection, but it also allows us to observe white blood cells, yeasts, and clue cells under the microscope. This test is very time sensitive. The trichomonas will die if the specimen is not brought into the lab in a timely manner. So we have said 30 minutes from the time of collection, otherwise it will be rejected and it will have to be recollected. Now we are going to create these ourselves in the lab. They're going to have 1 milliliter of 0.85% saline solution in them, and the kit will also include an unopened polyester swab. This is so that they can swab for those vaginal secretions that are going to go into the saline solution. Now these solutions are good for a year from the time they're created, so if you create one in October 2019, it is going to expire in October 2020. So for this test, all you're going to do is mix it thoroughly and put it on a slide with a cover slip over it, and then you're going to look at it for low light. You're going to examine at least 20 fields, and you're going to be looking for any kind of movement, budding yeast cells, any clue cells, or white blood cells. The white blood cells you do want to differentiate because they may look like immobile trichomonas, but if that trichomonas is not mobile, it's not going to be reported. The only limitations on this test are the amount that is given for observation. It has to be a large amount, otherwise you might not have enough specimen to observe those moving trichomonas or any of the other things that you may be looking for. Normal values of this are going to be less than 10 white blood cells per high power field, and when you're reporting it out, you're going to report anywhere from 0 to greater than 10 with trichomonas, clue cells, white blood cells, and yeast. If there's none, then you will report as none. Down at the bottom of the slide there, from left to right, is clue cells, trichomonas, yeast cells, and white blood cells, just to give you kind of an idea of what you would be looking at under the microscope at these wet preps. And then at the very bottom is a link to the material safety data sheet for the saline used in this procedure.
The RPR supplemental card test is a non-treponemal testing procedure for serologic detection of syphilis, which is a common sexually transmitted disease acquired via vaginal, oral, or anal sex. In short, the RPR can aid in the diagnosis of syphilis in the early stages of infection, when the disease is easiest to treat. The Brewer Diagnostic Kit for the serologic detection of syphilis package insert gave us two options. We can either pick the 18 mm qualitative card test using the dispenser's devices or the 18 mm qualitative card test using capillaries. Our lab decided to use the capillary method for the qualitative test, where results are read macroscopically in the wet state. In a quantitative test, results are also read macroscopically in the wet state. Results are reported only as either reactive or non-reactive. For those that has a minimal to moderate clumping, reports should always be reactive. At the bottom left-hand corner is a link to the safety data sheet for this SOP.
To illustrate, I wanted to portray the instruments that we may not regularly see within every lab, unlike centrifuges and microscopes. Our equipment is broken down based on their necessity of use within testing, which is ultimately also separated within the departments previously mentioned. In the top image, this is a picture of a Vista chemistry analyzer, which will be used to conduct our potassium and calcium testing. To the far left, this is a Beckman Coulter hematology analyzer, which will be used for the CBC and additional platelet count testing. And at the bottom of the slide, that image is a biotech incubator, which is used for the aerobic culture.
With our organizational structure, we did go a little bit smaller because with a county laboratory, they do not have as much volume coming through. So we're going to have a laboratory director at the head of our organization, followed by a safety officer and a quality team. This is to ensure that we comply with those OSHA safety standards, as well as have our quality assurance validated. We're going to have 4 supervisors, 1 for each of the departments: chemistry, microbiology, hematology, and immunology and serology. And then we're going to have 13 techs. So we're technically going to have 3 in chemistry, hematology, and immunology, serology. And then we're going to have 4 in microbiology. That 4th one in microbiology is going to be our float tech. So they are going to be kind of a generalized tech that floats across all 4 of the departments. And this is because of the volume that we are getting in. We are only going to have 1 tech really per shift per department with a little bit of overlap through the shifts. And that floater is going to be there for that 2nd shift to really help with that outreach that comes in that late evening to early night time frame. And then when we have our supervisors all go home in the evening, we're going to have that 1 3rd shift lead tech that's going to be able to take over and just monitor and be responsible for anything in the lab that needs to be done while the supervisors are away. Now, the purpose of our training policy is to give a guideline to the laboratory lead shift or laboratory supervisor, whoever is doing the training for the incoming employees. So the first thing is going to be a mandatory review of any laboratory policies or, the employee handbook for the lab, as well as our HIPAA, OSHA, and bloodborne pathogens regulations. Also, any safety manuals, occupational hazards and exposure control, or biomedical waste and universal precautions. All of these we want to make sure that they get a little review on when they first come into the lab, especially if there's anything that is slightly different from labs they may have worked in prior. Then they're going to have a test checkoff. So we're going to have a checkoff through each of the departments, our microbiology, chemistry, immunology, serology, hematology, and then urinalysis. They're also going to have a test checkoff on those waived tests. Some of the tests that they may be checked off on are urine pregnancy, mono, culture setup, a throat culture, wound culture, any of that. Maybe doing a SED rate or a PTT, any of those typical tests that we're running in our labs, they're going to be checked off on. Last, they're going to have a checklist involving operations and laboratory policies. So anything regarding cell phone use or smoking, the dress code, customer service, anything that involves them interacting with their job, with patients, or with other staff is going to be part of that checklist. And so once that has all been checked off on, it will be signed off and they will be good to begin working in the lab. The purpose of our employee competency assessment is to ensure that all employees are assessed, those assessments maintained and documented in the same manner. So they're going to be assessed by the laboratory director and technical consultant on the pre-analytical, analytical, and post-analytical aspects of their job descriptions. And this is going to be broadened into the 6 categories that are required by CLIA, listed there on the slide, including direct observation, as well as monitoring of test results and evaluation of problem-solving skills. These assessments are going to be done twice within the employee's first year of hire, and then every year after that, these assessments will be done once. The documentation on these assessments is going to be held in the laboratory director's office in the employee's personnel file. Any failure of these assessments is going to result in an investigation, so these problems can be identified as to why the employee did not complete this competency, and then they will have to begin remedial training, and once this remedial training is done, typically about 3 months later, they will be reassessed to see if they can complete that competency. If they finish remedial training and that competency is still failed, then a disciplinary action will be implemented. And all of this remedial training, disciplinary actions, all of it will be kept in the employee's personnel file. The continuing education policy is going to be very important for our MTs and MLTs to maintain their certification for the lab. They're going to be required to get 36 points every 3 years, so they are going to get 8 points across the 4 departments, so 2 per blood banking, chemistry, hematology, and micro, 1 point for safety, and then their other points can be in immunology, molecular diagnostics, management, or education, With CJK, because we do have an immunology serology department, that will be a very strongly suggested CE to get. And there are going to be two options that our employees have to maintain or achieve their CE. So the first one is going to be through CJK's Lab CE membership. They can log on and complete the approved courses. So any of those courses through the first 4 departments, and then there will be several choices through immunology, serology, and a couple others that they can choose from. If they choose to go outside our approved courses, they can maintain their documentation for it, their receipts, and bring it back to us for reimbursement. Now, it doesn't necessarily mean they will be reimbursed. We will have to approve the course that they took, but reimbursement potential is there.
Our laboratory safety plan serves as a document to describe and explain the overarching rules of conduct and other information that are conducive to the laboratory environment in order to prevent and respond to any incidents that may occur. The laboratory safety plan is used to cover safety, chemical and biological hazards, as well as radiation hazards. The plan is applicable and readily available for all laboratory personnel. In addition, it will be reviewed annually in order to ensure continued accuracy of the plan in relation to OSHA standards. Under general laboratory safety, OSHA standards is broken down into several documents. This contains the occupational exposure to hazardous chemicals in laboratories standard, the hazard communication standard, the bloodborne pathogen standard, the personal protective equipment standard, the eye and face protection standard, the respiratory protection standard, the hand protection standard, and the control of hazardous energy standard. As it pertains to radiation hazards, requirements must be met under the U.S. Nuclear Regulatory Commission, NRC. There must be radiation control, radiation safety programs, radiation safety officers. 3 factors that must be considered: time, distance, and shielding. Dedicated area for working with radioisotopes, as well as appropriate PPE, and monitoring badges must be implemented. In terms of physical hazards, ergonomics, fire, electrical, noise level, equipment, accidents, which consist of slipping, falling, lifting, UV exposures, and compressed gases must be addressed. Chemical hazards. This consists of hazard identification, which includes the list of chemicals. The MSDS must be available. Chemical hygiene plan, information and training, exposure determination, as well as medical consultations and examinations. As we transition into the biological hazards, this includes biological agents and toxins, bloodborne pathogens, and engineering control. And lastly, hazard prevention and containment. This encompasses risk assessment, hand washing, barrier protection, engineering controls, work practices, respiratory protection, immunization, warning signs and labels, and lastly, biological safety cabinets and chemical fume hoods.
CJK Laboratories is a county-based outreach laboratory. This means that most of our samples are going to be coming from surrounding doctors' offices, hospitals, or other facilities like that. Now, the lab interface system that we chose was specifically catered for outreach labs, and it allows the doctors to have this easy access portal to see their patients' results. Now, the lab interface system we chose is CompuGroup Medical's Lab Nexus, and not only does it have this easy access portal, but it has a user-friendly computerized physician order entry, so they can put their orders in much easier, and then they'll receive these results from anywhere, anytime, as long as they can access them from their mobile device, computer, or EHR. Now, we really liked that simplified information exchange, that the doctors are able to access it immediately, because this is going to improve patient care decisions. They can make them right then and there. But it also allows our lab to expand. So when we get CGM Lab Nexus, It's actually going to be the base package. As our lab expands and we get an increasing volume coming through, add on additional packages and additional expansion packs to allow for that increased volume without diminishing the workflow or slowing down turnaround times.
This concludes our presentation on CJK Laboratory. Thank you for taking the time to listen to our voices. Hopefully we did not bore you too much. Good luck.